All right, today I want to discuss inflammation and the process of, we've discussed this before in a previous video, but it's always good to go over it again, especially in regards to a new, more specific topic. So in the past, we've talked about inflammation and how most people think of inflammation as a bad thing, but really we should think about it as a seesaw, right? You hear inflammation, you think it's bad because inflammation is involved in driving pain. It's involved in driving cancer. It's involved in driving heart disease. It's involved in driving autoimmunity. Whatever we're talking about, inflammation is a fundamental building block for your disease process. So it gets a bad rap from people. And then anything that's anti-inflammatory is considered good, right? Because anti-inflammatories put the fire out. But we have to remember that there's really no good and bad in physiology. There's just necessary. So there's no good cholesterol or bad cholesterol. There's no good omega fatty acid and bad omega fatty acid in regards to 6s and 3s. There's no, on and on, whatever processes we're talking about. There's no potassium is good and sodium is bad. They're all necessary. They only become good or bad in a given context. So yes, if you are systemically inflamed, that is bad. But if you are inflamed because you're infected and you try and put it out too soon, that's bad. We don't want high anti-inflammatory levels when we're trying to be inflamed, right? So we want inflammatory balance, as you see on my seesaw here, my teeter-totter. But if you're infected, going up with the inflammation is appropriate in the short term to kill the infection. And then once it's killed, we want to go up in the anti-inflammatories to put the increased inflammation out and bring us back to balance, right? So today I want to cover this again in looking at the context of Streptococcus pneumoniae, which is the most common cause of bacterial pneumonia in the lungs. And this is a new study from the Journal of Clinical Investigation, where researchers are looking at new ways to help clear pneumonia, because, as I said, pneumonia is the most common cause of, Streptococcus pneumoniae is the most common cause of bacterial pneumonia in the world. And according to the World Health Organization, it's the leading cause of pneumonia deaths worldwide each year. So if we can better deal with strep pneumoniae and better deal with bacterial pneumonia or prevent bacterial pneumonia, then we can save a lot of lives. And what medicine typically uses is some form of antibiotic. And that can work, but in cases where it doesn't work, it can make things worse by driving antibiotic resistant bugs. And so once the bugs are antibiotic resistant, then the hospital no longer has a real solution for you, and that makes things hard. And so examples of antibiotic resistance are strep pneumoniae is to some, but the most well-known one is MRSA to lay people. MRSA is methicillin-resistant Staph aureus. So that's a staph infection that's resistant to antibiotics and, is a much more severe and poor course of infection than a non-resistant bug. So this new study looked at using things called epoxy-icosaptrienoic acids, or EETs. Epoxy-icosaptrienoic acids. Epoxy-icosaptrienoic acids. Say that 3 times, okay? So EETs. These researchers found that in an infection, our bodies make EETs, and EETs are part of that seesaw, okay? So when you have the strep infection or the bacterial pneumonia, you're in a normal situation, the EETs are going to be paired with soluble epoxide hydrolase enzymes to help modulate the inflammatory response to the infection. Well, these researchers found that humans so they studied mice, but they found that humans make EETs as well, and EETs are involved in that inflammatory response. And what they found is if you inhibit the enzymes that break down these EETs, the infection goes worse, the inflammation goes way worse, and the pneumonia is much worse. But if we can promote the proper levels of the EETs, then the inflammation happens to the appropriate level, you clear the infection, then the EETs have an anti-inflammatory effect to resolve that inflammation and put the fire out so that, okay, bug is killed. We're no longer going to keep high inflammation in the absence of a bug because that can promote lung damage and maybe lung autoimmunity. So we want to resolve that inflammation. We have inflammation against infection or against a wound, whatever the trauma is, at the appropriate amount. And then later we should, through anti-inflammatory mechanisms, resolve that inflammation, put the fire out, return to balance. And so it's just important to see this in the research and see researchers talking about this. This is the study that this article is talking about, and they were interviewing the authors of the study, and one of the authors was saying that EETs provide beneficial cardiovascular effects, such as lowering blood pressure and inflammation, improving cell survival after a stroke or a heart attack. And these EETs come from omega-6 fatty acids. Omega-6 fatty acids are essential fatty acids. Essential meaning we cannot make those. We have to consume those in our diet. So the average American consumes plenty of omega-6s, not enough omega-3s. You need both. Omega-6s would only be considered bad when they're overconsumed in relation to omega-3s, which is the standard American diet. So we want to have enough omega-6 and enough omega-3s because they all have a role. There are parts of omega-3s that have anti-inflammatory effects and resolve inflammation, and we've seen that previously, and I'll go back to that study in a minute. But EETs also promote inflammation and resolve inflammation. So this author says, he stressed, however, that the involvement of EETs in the process of inflammation can be good or bad depending on the context. EETs can suppress the inflammatory response, which is good in context, but if they block it too much, they're going to make it so the immune cells can't eat the bacteria, which is bad, right? And we've seen this in previous videos. You might remember these graphics if you've been here long enough. And these graphics are examples, 3 ways that your immune system could respond to infection. Okay, so the A block here, the yellow is the infection, the green is your pro-inflammatory immune response, the pink is your anti-inflammatory immune response or immune resolution. So the amplitude of the curves is the magnitude of the response, and the x-axis is time. So in a normal situation, if we use the example we've been using in this video, you have pneumonia, okay, strep pneumoniae in your lungs. So you can track bacterial pneumonia, and that's going to have a head start, a small head start on your immune system. You have the bacteria, your immune system recognizes it and mounts a pro-inflammatory response. Over time, the pro-inflammatory response knocks down the viral level, or excuse me, the bacterial level in this case, knocks down the bacterial level, and then once your immune system knocks it down enough, it recognizes, okay, we can put the fire out now. So then your anti-inflammatory immune resolving response occurs. Okay, so that's normal. That's how it should happen. If we go to B here, you have the same bacterial infection, but you get a overly robust pro-inflammatory immune response. So you clearly kill the bacteria, but then your resolution, your anti-inflammatory response isn't strong enough to put out the pro-inflammatory response. So now the bacteria is gone, but you're still chronically inflamed. And now there's nothing there to kill except you, right? So if you stay chronically inflamed with no target other than you, that could lead to autoimmune disease, that could lead to pain, that could lead to all kinds of issues. So we don't want that. And then the last scenario would be you have the bacterial infection, but you can't mount a robust enough pro-inflammatory response because your anti-inflammatory response is too robust. Okay, so here's where too much anti-inflammatory response would be bad. You're chugging down the fish oils, you're chugging the turmeric and curcumin and resveratrol and everything you see from Dr. Axe or everything you see on Google about good anti-inflammatory things. If you're too anti-inflammatory, that could cause you to be chronically infected and chronically inflamed at the same time. Okay, because why? Well, if you're too anti-inflammatory, you're chronically infected because you're suppressing your own pro-inflammatory response to kill that bacteria. And you're chronically inflamed because you're suppressing your pro-inflammatory response, but your pro-inflammatory response is still trying to respond because there's the bacteria present. Okay, so this is, if we made it a picture, this one would look like this, nice and balanced. This one, this one would look like this. Okay, and this one would look like this. So too high on the anti-inflammatory side, too high on the pro-inflammatory side, and this one's Goldilocks. This one's just right. So we want to be balanced. Balance promotes health in physiology. And so we want to come from balance and be able to respond the right way. And I said a moment ago that we have seen this before. So let's show you where we saw this before in the context of omega-3s. This is a study that we saw in the context of omega-3 fats and dealing with lung infection. And this study showed that, you know, if you had enough omega-3s, the infection would be mild, but if you didn't have enough omega-3s, it promoted a more severe infection. So we've been talking today about EETs, which come from omega-6s to promote or modulate inflammatory response to lung infection. This study here was talking about specialized pro-resolving mediators, which come from omega-3s and help modulate immune response to infection. So however we're going to talk about it, whether we're talking about an omega-6 sourced version or an omega-3 sourced version, the key take home is that we need to have both, and we need to use both appropriately in the right context. So it may not be appropriate to always be consuming high levels of anti-inflammatory substances just because, you know, Google or a magazine article or something is pumping that as the next, you know, health magic bullet. The only magic bullet is consistency, and we have to be sufficient in the things we need, but not overdosing on them. So let's open that up to question or comments.
So I guess I'm somewhat trying to connect the dots here for me.
Yep.
EET, what is that? It's an acid. I think it did say S.
The fatty acid. So
Yeah.
So
Go ahead, please. No, I think you got my point.
So it's derived from omega-6. So omega-6 fatty acids are one of the essential fatty acids, omega-6, omega-3. So the epoxyicosanoic acids here are derived from that. It's a derivative from arachidonic acid specifically, which is the parent omega-6 fatty acid. Where do we get those? Cookies, crackers, chips, breads, nuts, sunflower oil, safflower oil, canola oil, all the American favorites. Okay, all the pro-inflammatory American foodstuffs. So, you know, in the typical American diet, the average ratio of omega-6s to omega-3s in the U.S. diet is 40-1. Ideal, if you look at hunter-gatherer populations, is between 1-1 and 4-1. So the average American is 10 times higher than is normal in the pro-inflammatory side. So it's not that they're lacking the EETs. In this case, they would just be imbalanced and be having too much, so that immune dance would be highly bent towards that pro-inflammatory side. And at the same time, the average American is deficient in omega-3s because those are only coming from wild-caught cold water fish, chia, and flax, if you can convert it. So most people don't eat enough of that, and therefore, even if you don't have high omega-6s, you might have an imbalanced ratio just because of your lack of omega-3s in that case. Make sense?
Yeah, it does. But in our body, just to extend that point a little bit more, what causes inflammation and what causes anti-inflammatory, properties? Is it only omega-3, omega-6, or are there other things? Just a balance between the two. Does it do the magic trick or most of the magic?
Oh no, there's a whole boatload of things involved, but this hour is on this one.
Got it.
Yeah. What can cause inflammation, what can't. Okay. Diet, physical inactivity, too much physical activity, mental states, lack of sleep, environmental toxins, EMFs, all kinds of stuff can cause inflammation. And then what can put it out in the context of today's videos, EETs help with that, omega-3s and SPMs help with that. But then, there's all kinds of other mechanisms, from your vitamin Ds to your turmeric, curcumins, flavonoids, resveratrol, quercetin. I mean, the list of anti-inflammatories is about as long as the list of pro-inflammatory things. So it's on the individual level. In Niraj's case, why is he inflamed, and what are the linchpins for us in that case to leverage, versus in Karen's case, there's a whole different combination or alphabet soup of stuff that needs to be leveraged or tweaked differently.
Yeah, got it. Thanks.
Yeah, I hope that answered it for you.
Yeah, it basically tells me to study more.
Yeah. If you're into it, study more for sure.
Yes.
While people are thinking of questions, I can show you a little bit more, Niraj. I just need to go to find this graphic from my book for you. So,
By the way, I just downloaded on my Kindle, and I'm still at the start.
Okay, cool. Well, thank you. I appreciate it. And if you like it, leave me an Amazon review, please.
I would, and I owe you name of the app where we can extract the key information. I will send you an email.
Oh, yes. Thank you.
Yes.
So here's a graphic from early on in the book. It's in the introduction. Okay. So you said, so inflammation is appropriate, right? If we have a wound, or I contract bacterial pneumonia or cancer or whatever it is, the immune system should respond, and it's going to respond in a pro-inflammatory way. There are two sides to the immune system as it's taught in medical schools or immunology. One side is called the innate immune response, and that's the first responders. Okay, so that's the local police. It's kind of how I describe it. Those are things like macrophages, dendritic cells, neutrophils, things like that. So you get a wound or you have the infection, these are the first on the scene. They're going to start the fight right away. Okay, and then you have what's called the adaptive immune system, which is here. And the adaptive immune system is T cells and B cells. Okay, and these take 3 to 5 days to clone out. So B cells make antibodies. T cells are the real assassins of the immune system. So what happens is you have a cartoon hand over here that has a cut. Ow. Okay. So you're going to have a dendritic cell nearby that's going to say, "Ooh, injury," and it's going to take a sample from the wound, and it's going to, say, let's use infection instead. It's easier. So there's an infected wound here. The dendritic cell is going to take a sample of the tissue, and that's right here, this black circle. Now it's red. Okay. So the dendritic cell is going to go to a lymph node, and it's going to go and show it to T cells. and B cells. B cells will make antibodies against this target here. T cells have a receptor that match that target, and then they're going to travel back to the site of injury or infection, and they're going to look for cells that match its receptor and inflame against it and go kill it. Okay, so it's going to kill the infected cell, or if it's a virus, it'll kill the cell that's infected with the virus. If it's a bacteria, it'll kill the bacteria. The bacteria is bigger than our cells. So, and then you can get more granular. So depending on where the infection is, when the dendritic cell presents this in the lymph node to the T cell, this is a naive T cell. You see the 0 there. So this is a baby. It's chubby, got cute little wrist lines, ankle lines, chubby legs, cute but useless. Okay. It needs to mature from a baby to an adult. And when it's an adult, it'll be a lawyer or a doctor or a contractor or whatever the different jobs are. Okay. They all do different things. So let's clear that up. What determines which way it goes are the chemicals in the environment, Niraj. So these things that you're seeing on the lines. Okay. So these different cytokines, they're called cytokines or chemicals, are information telling this baby to mature into this job or this job or this job. So depending, you said what inflames someone, depending on the type of inflammation, there's different cytokines in the environment, and it tells this baby to mature into this type of T cell to go deal with that type of inflammation causer. Okay. And so, for example, interleukin 12 will promote a Th1 cell. Those are our main antiviral and anti-cancer cells, our anti-infection cells. And interleukin 4 will drive this to a Th2. That's sending it to mucosal barriers, gut, lung, sinus, bladder, allergies, mold, pollen, parasites, that sort of thing. Th9 is the same thing as Th2, but more intense. So you're going to have a greater kind of histamine type response there. Th17 is mucosal barriers, similar to that, but also this drives the tissue damage seen in autoimmune disease when inappropriate. Th22 is a high inflammatory response. T follicular helper cells, this is a big antibody response, and T regulatory cells quiet it all. So these are the anti-inflammatory, tolerance, calm down, tolerate that, don't overreact. So depending on the combination of these different cytokines, dictates the immune response and the type of inflammation and what we're becoming inflamed against.